Okay. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law and the governor's March 15th order imposing strict limitations on the number of people that may gather in one place, this meeting of the Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation can be found on the Office of the Attorney General's webpage. No in-person attendance of members of the public will be permitted. Draft minutes will be posted on the town's website as soon as possible after the meeting. Pursuant to Mass General Law, in an emergency, a public body shall post notice as soon as reasonably possible prior to the meeting. Notice shall be printed in a legible, easily understandable format and shall contain the date, time, and place of the meeting and a listing of topics that the chair reasonably anticipates will be discussed at the meeting. Okay. We'll wait for Jessica.
Gotcha.
Okay.
I'm here. The
Hi,
other
Jess.
link didn't work. Sorry. I'm just.
Okay. Do we have December 3rd minutes still on the table?
Yes.
Okay. Can I get a motion to approve those minutes as corrected?
Are these the minutes we just got the other day, Jessica?
No.
Those are the ones from the 20th, from the 17th. For some reason, we tabled the 3rd because it was.
I didn't have them ready.
Didn't have them ready.
There's two sets of minutes that need to be approved.
Right.
One of them was December 3rd.
Right. And then that's the motion I called for just now.
Right. So I'll make a motion to accept those minutes.
Okay. Second. Okay. All in favor? Jerry, yes. Sue?
Sue, yes.
Jean?
Yes.
Okay. We'll move on to the December 17th, the ones we just received. Any corrections that are substantive that Jessica need to know about?
I thought they were very good.
Yes.
Thank you, Jessica.
Jean? Us too,
Thank
Jessica. You. Okay. Can I get a motion to accept those minutes, please?
Make a
Yeah,
motion.
well, Jessica, there was one part there that you hadn't read. Tammy, did you correct that?
Oh, yeah. I didn't know if there was a specific public health nurse that was covering for Kate.
Okay, was that corrected?
If it is, I don't have the correction.
Kate, who was covering for you? Doesn't hear.
The CTC.
Yeah.
While I was gone.
Is it pertinent?
And me.
Hey,
And Tammy.
Oh, okay. I
Tammy-
must have misunderstood the.
Hold on, Jeannie. Go ahead.
now, Tammy, did you correct the minutes that Jessica did, that little section in red about the health nurse?
No, I
Okay.
don't remember that.
Well, I'm going to make a motion to
was
accept
it?
those minutes once Tammy has the correction of who the health nurse was that took over for Kate in the portion of the minutes. Okay?
Second.
It just requires like a name in there or something.
Who was
Second.
CTC?
Yeah.
Okay.
Mhm.
Second, Sue.
Yes, second, and I'm in favor.
Okay, all in favor. Jerry, yes.
Jean, yes.
Sue, yes.
Okay. All right. Public comment, since there's no, well, actually,
I'm gonna.
there's
Public comment.
there's no public here today, so we'll skip that.
When am I getting my vaccine?
Before we get to the report, I had a conversation with someone today, so I'm going to bring it up because I didn't anticipate it. It's not on the agenda. It was brought to my attention that towns around us, Agawam and Springfield, have waived significant license fees. Agawam and Springfield completely waived the liquor licenses. I want to know if you two want to revisit our fees and decide if we want to refund some of those that have been paid for at least 6 months, if not the year, because the people that have been hurt the most are obviously the restaurants. And that's going to continue for a while. This vaccine is not going to get them up and running for another 6 months. I'm wondering if either one of you two are interested in discussing that. Jean, Sue?
Sue, go ahead.
Has everybody paid? Or Jessica?
Can you repeat that? You cut out.
Have we received all the fees from the restaurants?
Yeah, almost all of them except for maybe a handful.
What are you thinking, Jerry, to cut it, what, 50%? What?
Well, yeah, I would want to, or cut it up 100% for half the year, and then you guys can revisit it back on July 1st to see if you want to reinstate it for at 50% for the rest of the year. In other words, give them a break for the 6 months, and then if the economy picks up to any degree, then we can reinstate it for half the year.
What are you talking about being stated? Willem, what are you talking about?
Well, okay, so
That's a lot of work, Jerry.
Yeah,
I'm sorry?
a lot of
A ton
work.
of work. Like the money that we'd be giving back, Jess would be charging us in time. Like that is a lot of work refunding.
Listen, I'm just a messenger. So
I will say, I don't know if you remember from in our discussions when we talked about reducing fees, I did talk to most of my cohorts in Hampton County, and health department wise, no health departments removed their fees.
I
for
want to bring it in
2021.
front of the board, and I want to know what you guys think about it. I just need a yes or a no.
How many restaurants do we have?
I'm sorry,
How many restaurants do we have?
Jessica?
Boy, I would say
60 permits?
Right.
Not like big
Over
one.
60, right?
I would say, I wish I had the paper in front of me. Maybe 30. Because we have the retail too, you know what I mean? So I have like the whole number in my head.
Yeah, not retail.
Oh, you know what? Actually, I can tell you in a moment. If you give me a few minutes, keep talking, and then I will let you know.
Okay, Jerry, you mentioned liquor licenses. Is the select board going to?
That's not our purview. So
Right, but you
What?
did mention that when you first started. So are
Exactly.
the select board going to return all the money for the liquor licenses? If that's even allowed by the,
I understand that they've reduced it to a certain percentage for each separate business. Is that right, Doug?
That's correct.
Okay. So it's done by a case-by-case basis. Is that correct?
No, there was we had a chart that we followed through on different. There was a couple of different situations for those, and the discount was different based on that.
Yeah. For instance, Southwick Liquor, made a ton of money, and probably Village Pizza lost money on their liquor sales. So I thought they probably were treated differently. So
It was based on those that were closed and those that were not closed for any period of time.
there you go.
Mm-hmm.
So I thought it was.
I'd like to bring something else up about the fees for this year. Regardless of final outcome of 2021, I allowed businesses to take to send in a fee according to the tables that they have right now, the lowered amount. Even if they get to go back to full, I really felt like it would just be more fair that if you went down to from 50 to 25 seats to charge you for only 25 seats.
So you're telling me that they've already received a discount?
Yes. If they've contacted me about it, wondering what they should put, which we did get quite a few restaurants like Tucker's, they took some chairs out, which just a few chairs brought them from one bracket to another. Mm-hmm. Like that, by doing that, it put them in. I felt that, even if miraculously in 3 months from now we go back to it, it just made more sense to just start at that lower level, and we'll revisit it for 2022.
Is there
Seems
any
so
way
weird.
that we could find out if all the restaurants that got a reduction in seats could have been afforded the same courtesy? In
There
other words,
is.
some of them just might have paid because they didn't know they were eligible for the discount.
I wouldn't, I'd have to figure. Not a lot of businesses, because when we did the reopening, a lot of businesses were able to keep their same number of seats just by doing reconfiguration, but there were a handful that weren't going to be doing, especially like a place that was high, places that relied a lot on events is where that I think was the most affected.
So I'll ask both of you again, do you feel like revisiting the issue?
We just get a list of those people that Tammy's talking about.
The ones that are left.
Well, why don't we get a list of the restaurants and of all the restaurants in town and how much each paid and what they're eligible for, and we can contact them. I think it's not the money here. It's not the money that we spend. It's the look during the pandemic that hopefully will only come around every 102 years. We'll face this again, and if we do, we can deal with it, or you can deal with it the next time. But I think.
I'm
Hey,
sorry,
go ahead.
Jerry. I just had a question. I have no concept of fees. Like what are the fees that we're talking about?
$25.
That's it.
A year?
No, like the different, like every time you say you would go up from 100 to 125 to 150.
Okay, but what would a normal year be without?
What's Roma paying food fees to us?
Like 100?
Maybe what? 150, Jess?
You want Roma?
Oh, you got it?
Yeah. I was just curious what it is. Yeah.
Oh, plus catering.
I'm working on a whole new computer system, so I'm sorry. It's taken me a minute to
Go ahead.
in here. $200 for their food establishment permit because they have the larger room, but they also get a catering permit that's $100.
So it's $300. So I don't think it's the money that we're going to lose. I think it's the goodwill we're going to spend with everybody in town to give them back some of their money because they certainly have lost it.
How about this? We will Jess and I we'll put up a list of we'll put together a list of restaurants and what they paid for, and then we can send through an email a survey to the restaurants, or I could print one out. If you are currently operating at with less chairs, let us know and we can figure out how to prorate or something.
I would like to see the list in general.
Yeah, why don't we see the list first and then we can decide what to do about it? Is that okay with you, Sue?
Yeah, definitely see the list and then we'll figure it out.
Yeah, why don't we get a list and what everybody's paid?
Are just the spreadsheet or
Yeah,
Yeah.
something we can look at and say, well, this happened this year, that happened this year. Just it's all.
It's not gonna. I don't think this is a year. We're not going to face this on a yearly basis.
Just to get a comparison of who paid what last year, who got the reduction because of the reduced seat.
I can tell you it's probably less than a handful.
Yeah, like
I would imagine that paid a lower amount due to a reduced number of seats.
So let's get the list so Sue and I and Jeannie can take a look at it, and when we can finalize it at the next meeting. Is that okay?
I can get that to you in the morning. If I was at the office, I would be able to pull it up.
That's okay. Tomorrow's just fine. Sue, is that okay with you?
Yeah, and then we'll take it from there, whether you want to do a percentage or what you want to do.
Sure. Jeannie?
Yes.
Okay.
Right.
Okay, now we move on. Health Director, Madam Spencer.
me. Let's see. It's been a bit of a busy couple weeks. Let's see, I approved septic plans for 10 Crystal Drive, 19 Fernwood, 12 Noble Steed Crossing, 14 Noble Steed Crossing, and 20 Noble Steed Crossing.
Are these new ones? New or repair?
Almost all new. The Crystal and Fernwood were repair, and the Noble Steed are all new. And I've got actually, like, I haven't even finished a couple more new projects on my desk just today. So this is, I don't know, money coming in for the holidays. Everybody's building stuff. So it's, I think we're going to see more, a lot more happening over on like Tannery now, because we've done
they're building.
Yeah.
So
we're going to be seeing a lot over there too. Did final inspections on 19 Fernwood and 10 Crystal Drive. I did a food service establishment for Hilltop Cafe, and I did a pool inspection for
How was Hilltop Cafe?
a bar with hot dogs.
Uneventful.
They haven't been open.
No, it's a little.
He decided not to open for the pandemic, and until we did the renewals, and I kind of talked him through the ways he could open, and it's fine.
So how are you handling this? Are you doing inspections on all the food establishment places right now, or how are you handling this?
Only necessary inspections, because I so for the pool inspection, I made them follow behind me and wipe everything. Like, I touch every handle, I touch every sink, I touch every shower head. It is very irresponsible. That's my style of inspection. I am very hands-on. I'm in. So to go around and do that in places that aren't necessary is not a smart idea right now, in my mind. Not for me and not for the places that I'm in, but for the people who want inspections, need inspections or complaints, absolutely, which is what most of the health departments around here are doing.
That's fine.
Let's see. Huh?
I said that's for Sue. You agree?
Yep.
Jean?
Yep.
Okay.
And I've strangely, in this weird climate that we're in, how the relationships I've formed with people that I've barely even met, like over the phone or in parking lots, and businesses who will call me up just to kind of ask me, like, are we doing this right? And, am I reading this the right way? Especially because Jess had sent out the letters right before Christmas. And so it's strange getting to know everybody in this sort of atmosphere under these conditions. It's neat, I'll tell you that. Like, even going into places for the first time, like during a pandemic, is so different than like I say, like going into a bar that hasn't been open for a really long time is not the same place. Not in the atmosphere, but it's neat. Especially I was just talking to somebody this morning who happened to used to be a health inspector, and there's the beginning of the year is this new time of year where you kind of feel like you scratch everything off and you start your list up fresh, and everybody gets to start with a new chance, and you look at all your businesses with with new eyes. That probably goes way in the next 3 weeks, but in a normal year. But it is a nice time of year too, especially starting with the new numbers on the permit list and everything. It's refreshing in the light of everything that's going on. Let's see. This morning I chaired the Hampden County Health Coalition meeting. So the health departments have been meeting still on a monthly basis. Everybody's keeping very busy. So it's kind of good to kind of check in with my peers on a regular basis. I could not even count to everybody how many meetings and webinars I have been on in the last 3 weeks that have to do with COVID-19 vaccine or COVID-19 in general. I had one today, 2 yesterday. There's so many with every agency known to man. I said today, Jerry called. I had just finished one up and another one started, but I wanted to hear what the governor had to say. Like, it was just keeping track. Although I will say that at this point this week, they're repeating a lot of the same sentiments over and over again, which we might as well just move on into that because that's kind of the end of all things not COVID related anyway.
Hey, have you had any housing inspections lately?
No, other than keeping track of 246 Feeding Hills Road, no one's called. So that's a good thing for now.
Non-COVID, what about the church?
Is that non-COVID?
Well,
COVID, but you might as well get into it.
Okay, well, I feel like we got the best outcome that we could get. Actually, I had a hard time finding somebody, but I told you guys that day I would get on it that day, and I did.
Thank you.
It just so happened that I had a message from a contractor who had questions working there, and I decided to call him up. It just also so happened that he was on the board at that church, and I'm sure that was Monday. I'm sure they must have saw everybody photographing them on Sunday because that night they had a board meeting and they had decided that they will do 2 services for this period. So they have done 2 services. We figured it out. I did go on Sunday. There's no shortage of pictures they took of me as I was counting in the parking lot and looking inside and everything. So they did what they said they were going to do. They were in the range that I asked of them. And I had a very long, lengthy conversation with him about lots of things and got to find an understanding of where like they are and how they feel. And it was very interesting, but I did it. I'd like to move on.
Thank you.
And they're going to keep it up.
Are you convinced that they will?
So Kate, not Kate, I'm sorry. So Jess, actually, this afternoon, within 15 minutes of the announcement being made that the restrictions are going to cover the next 2 weekends, Jess was able to send letters out to everybody. And I'm going to try to give everybody a call because I've actually had a lot of people call me up. So now I have some phone contacts for the different churches because they're not the only church that have questions and didn't understand it. I will say, even, their next door neighbors didn't understand what these restrictions mean. So I'm sure I will keep in touch with everybody, and everything's kind of ongoing, but I think they're doing what they need to do, and they're understanding of me now, and I have contact. So to
finally kill this, nail it, finish it.
Please.
Do we monitor them now, or do we just take their word that you're talking to has done the job?
I will continue to do my job and to continue to keep an eye on everybody in town, but there's lots of things going on right now. So
I mean, we're close by when we drive by on a Sunday. I still don't know what time mass is. Is it 9:30, 10, 10:30, 10 to 11? 10 o'clock.
10 and 12.
Is not going to give you
it's not. No.
It's not going to give you a true picture.
Yeah.
Well, yeah, there's no
people counted.
Okay.
The number of bodies I counted and the number of cars are not the same number.
Right.
Yes.
But at least the parking lot won't be jam packed. Won't have 150 something cars.
It still looks like it because the worst part of the parking lot's the front.
Right, but there was no parking really in the back this time.
Exactly. Yeah, but it doesn't look like that from the road until you go into the parking lot. And you realize that the back has at least a good 50 like empty spots before you hit the extra parking area that's not paved. So yeah, they've made an effort. They were wearing masks, not everybody, but
you're not going to get medical certificates from everybody.
Yes, the staff and the board, and they understand it. They understand those needs. And, you know, we had very interesting stories about some of the things that have happened within the congregation between people and masks, and it's very interesting. But I feel like it was more of a private conversation that he had with me.
It's okay.
Did they have signage up?
Yeah, I gave them signage twice, and they have those signs. Yep.
So are we done with the church for now? So
Yeah, I mean, we'll still monitor it.
okay.
I'm gonna ask a question on the churches. So if we're treating that church one way, we need to treat all the churches the same way.
Absolutely.
And so I don't think we should be, we can assume things by driving by, but I think we should be very careful as a board that if we have concerns that we need to be checking in with all churches.
I think we've done that,
Regularly.
as board members. I'm sure we're aware of all the different businesses, that there's not one specific business, there's not one specific church. So I'm pretty sure as board members, we've done that.
Then we need to know that. We need to know that, Jean, because
Okay, Kate, is your church following the guidelines?
I'm not getting the sense that we are watching churches like we're.
But there's a lot of things that are happening, Kate. Now, keep in mind, everybody has to stay home. Everybody has to be cognizant of travel. And not everybody does it either. So.
No, that's not what I'm talking about, Jean. I'm talking
Hold
about.
on, let Kate finish.
If you're looking at
I'm sorry. Go ahead.
If you're looking at guidance for churches, then we need to be looking at guidance for churches.
Okay.
That's what I'm saying. All the churches in our community should be upholding the same thing. So if we're focusing on one, we should be checking in with others.
Okay, so Kate.
Period. So because it could be perceived that this is getting very personal and we don't want to go there.
Kate, I'll ask you a question. Is your church, what's your church's protocol for services?
My church is closed.
It's closed. Okay. Now I called up the Lutheran church, and the answer I got was they're strictly following the guidelines. One entrance in, one entrance out, no communion, only family seats together, everybody wears masks. I guess we could call who else is left? The Congregational Church, the Methodist Church?
Congregational, there's the Methodist, there's the Catholic Church.
Okay.
There's probably 7 or 8 in town.
It's about 5 different churches. So
okay.
Yeah,
so whose job might that be?
Yeah. And and I'll be honest, I've had some of the churches call me and tell me that they didn't realize that weekends had already gone by within this order, because when they were looking at it, that they had missed the first weekend. And
okay, I think Kate has a good point. So
I just think we need to be very clear about how we're communicating, what we're communicating, and that everyone understands the expectations.
I think you're correct. I think
community, etc.
I think what's happened is that probably on a weekly basis, one of us gets a complaint about this particular church because it's high profile. It's on the main highway and their parking lot's jammed. And we go by the Methodist church, it's not. We go by the Lutheran church, it's not. I don't know what the back of the Lady of the Lake looks like, but I can check it on Sunday. I think we only can go to the fires that we get called on, but I think Kate has a wonderful point. And if you two want to leave it up to our director to get what each church is doing, that's fine with me.
Hey, also, we got complaints about this church from the public. And I don't know if we got any complaints about any other churches, did we, Tammy?
But that could be perceived as hearsay. Unless you see it, Sue, that's
we saw it.
We have seen it, Kate.
I never received a complaint until actually last week.
Okay, so if it's okay with you, Sue and Jean, we'll let Tammy survey each church in town and find out what they're doing to to adhere to the public health protocols. Is that okay?
Absolutely.
Jane? Kate, would that be okay with you?
Yeah, that's absolutely fine. I just think it's very important that we look
right.
at those entities across the board the same way.
I think you're 100% right. Tammy? Okay.
I think taking back Kate's Christmas present.
Well, I don't think it's going to be hard, and I don't think it's going to take a long time. But I think that's what I think it's going to.
I'll add that with all the extra permit stuff that will be just and I will be.
Tammy, you know, if you need me to call, I'm happy to call. I don't have a problem with that.
Kate's volunteered to do that. Is that okay with you, Sue?
Like, just tell me what to do.
Let me figure out my game plan tomorrow.
Yeah.
Okay.
That's fine.
I think Sue, is that okay with you that Kate does that if Tammy thinks it's okay?
Yeah, well, let Tammy figure out her game plan first.
Jane?
Yeah. Sure.
Yeah, I think it's up to Tammy.
Okay, Tammy.
Yeah. Tammy, do you
are comfortable with Kate doing that, then go ahead and let her do it.
Am I happy with this project?
No. No. I don't want to know if you're happy. Do you have contacts?
Yes.
With different churches.
Okay.
We keep a congregational list even on the town website.
Okay.
I think we've beaten this horse long enough, and I think we need to put it behind us. That's what I think, for everybody's sake. So I think this will do it. I hope.
Because for the congregational church, let me see, we don't have a pastor. I don't know if we have a secretary. I think we're kind of falling apart.
Not the point. I think Kate's point is very well taken.
I know. I'm just threw that out there.
Okay. All right, let's move on.
Is Terry Putnam with yours?
Yes, Terry Putnam is.
I have talked a lot to her about
She's
the
moderator.
Yeah, she's fantastic. Yeah,
she is good.
And Kate's mom is in charge of is the organist.
That's my mom.
Yes, there is.
Mm-hmm.
A
And
wonderful
Lady
player.
of the Lake.
And Lady of the Lake, right.
She's a musician everywhere. She's funny.
Like I said, at one time or another, just, I'd say, so we have 7 churches. 5 of these churches, I've talked to them about their plans, their problems, things they can't understand. So
Okay.
Yeah,
is
I think
that
it's hard for
enough?
them.
Or
I think the board, this board has taken up enough of your time and our time with this. I think we need to get behind us once and for all and move on.
And my point is, if I saw clusters in churches, I would be raising that red flag. Believe me.
I'm sure you
I have
would.
no evidence.
Okay.
So.
All right.
do we want to talk about numbers first before moving on? Kate?
Numbers is fine.
How do we do that?
It's your
I'll
report,
give you-
Tammy. Go ahead.
Do you want me to go?
Yeah, Kate. Yeah,
Okay.
that'd be
All right, so some snapshots. So I'm going to go to the DPH report that came out today. So right now we've had 8279 people tested in our community. So that's an 84% test rate. The total positive tests for the last 14 days is 60. That percentage in 14 days is 8.28, which is almost 3% higher than the last reporting date, which I'm not surprised. But Hampden County is at 9.44. So Hampden County also went up about 0.5%. If you look at counties in general, Essex and Bristol are higher than Hampden County. So we're one of the 3 highest counties with the highest percents. So it is what it is. We will be in red, obviously this week. Next week, next reporting period for DPH, we're already at 53 cases with 2 more days left. So I'm guessing that's going to be closer to 60 again.
In 2 weeks or 1 week?
2 weeks. 2 weeks.
So my question to you, Tammy, is we were at 274 as of last Friday. If I remember,
No,
284. If I remember correctly. So what's that number going to be tomorrow?
For total cases?
No, for you. So
Yeah,
when I look at
total cases.
when I look at the town website, I go back a week and I see how many cases there were for that week. So for the last 2 weeks, we've gone off 14 cases each week. So we're at, I think, 284. We were at 270 the week before and 256 the week before that. So what's the number going to be for tomorrow? Do you have it? Tammy.
Me? No, I usually ask Kate on Friday morning.
Right. And so what the number I give Tammy is I go all the way back to March 1st to the current date, because I can tell you that people are getting incorrect results. So positive cases are becoming negative. People move, right? And that's happened several times. So what I do is the number I give Tammy is March 1st to the current date, okay, which right now, the state says we're at 310 total. We're actually at 344.
So
344.
So the number would be tomorrow would be 344 or would be 310?
Yes, that's what I would report as of tonight.
So that's an increase of 60 cases for the week.
That would be correct, according to DPH as well. Yes.
So
they have us at 60 cases for the last 2 weeks.
So we're at epidemic then. Pandemic in town.
Yeah. We're in whatever you want to call it.
Deep red.
We're in the deep red. We'll be in the red next week, possibly the following week.
Clusters, school kids, families traveling. What's the
lot of families? Couple families with 4 to 5 positives. Otherwise, it's one here, one there. So I'll just give you a little more narrow perspective. So between 12/27, right after Christmas, and tonight, we've had 53 confirmed cases, 16 contacts. Wow. Yeah, 16.
Since the 27th?
Since the 27th.
All pre-Christmas and Christmas.
Yeah.
Most
right
likely.
After Christmas up into, through New Year's.
I'll tell you, the system was so quiet while Kate was gone. it was so eerie. I was like, this is odd. But that week of Christmas, I think it was like the buildup, and people hadn't gone yet to test and everything. And then then right as you were coming back, it was ding, 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 ding.
They were waiting. They were waiting for me to come back to Puerto Rico.
I was checking like so many times a day, and I'm like, this can't be real. And it was, wishful thinking that it was reflected of what was going on. And just like you said, like you'd look and it would be 7 would show up and you'd find out it was the same household. And you're like,
yeah. So I'm getting 5 to 7 cases a day. Again, some people will tell me close contacts, and most people say we've notified them. If they're symptomatic, we've advised them to get tested. So it's kind of a hit or miss in terms of contacts.
Anybody in the hospital?
No.
Any more deaths?
No. Mild symptoms. I'll share with you the symptoms that I'm hearing about the last month. Nasal congestion, sneezing, head pressure. That's it. No fevers, no diarrhea, no vomiting.
Have the people been younger, like in their 30s, 40s?
There's a lot in their 20s also. Yeah. So there's a range. but I would say like 25 to 60, maybe is what I'm seeing. And
So
then
is there anything the
outliers.
board can do to accept what we're doing?
Nope.
Do we
I can't tell you, Jerry, how many phone calls I've received from people saying to me, I went to my friend's house on Christmas Eve, and somebody came down with it. It's so
they admit it.
Irresponsible. A lot of businesses call like, oh, my secretary, I just found out, went to a party on Christmas Eve. What do I do? And this Monday was insane. The phone calls like that. Just some of it was within our own municipality. Right.
I'm not surprised.
Went to a New Year's Eve party. Oh my goodness.
It is what it is.
Yeah.
All right. Sue, any comments or suggestions?
Tammy, is Governor Baker's guidelines in effect now for 2 more weeks?
To the 24th.
To the 24th now, okay.
25% capacity, is that right?
Yeah, same thing.
Same thing.
Nothing
different.
different.
Have any comments or suggestions?
Yeah, it's not getting spread in these places. This is
sorry, my clicker, my mouse wasn't working. No, thank you.
While the other portion of the new COVID, the temporary COVID measures are called, is also for gatherings, and it does talk about gatherings in homes, and it reiterates that there's no gatherings of more than 10 anywhere. So I don't know. It gives me heartburn knowing that I spent my Christmas all by myself in my house with my family, wearing pajamas, and that all these people are doing this, and it just giving Kate all this extra work to do. And
can we put this on the billboard? Is there on the billboard? I go by it and I think I see something about Corona, COVID-19.
There's lots of stuff. There's a lot of different messages on the bulletin.
Okay.
There's a lot, these 30-second messages on channel 15. Dennis Clark put up a lot of those little videos. They're really nice videos, but I think it's still fatigue. It's, people have heard the message, and the message really isn't different than any other message.
That's correct.
It's really kind of what, we'll keep the message going, but I'm not quite sure until it happens to them. But then when it happens to them, yay, they're immune, I guess.
They don't die.
It's very frustrating, especially when there's, there isn't a different message that goes out there.
What I tell people when I talk to them is this is a 10 to 14 day window based on your home. You're building antibodies, right? There's extremely little evidence of reinfection. And it's, I don't even know what it is. It a rite of passage? It's something that they're not even physically ill. It's psychological. So I say, okay, you got tested positive on the 1st, by the 15th at the latest, you've gone through your quarantine, isolation, et cetera, based on the house. So you have to give some perspective to people that this is not like forever. And again, I feel blessed that 99% of our community, very few deaths and very few hospitalizations. So that's where a lot of my time is spent on the phone. It's not symptom collection, close contacts. It's, it's this other stuff that they need to be processing. And that really is the reality of this flu.
Do you ever get any questions about groceries or anything like that? That actually survey just came in yesterday about food insecurity.
If so I do ask families, you know, financial assistance, if there's any indication. They may not say it to me on the phone, but I give them the CTC number. I said, maybe, you know, maybe you want to wait a day, but if there's needs that you have, and I just refer them to CTC.
Yeah.
Yep.
I know with like the senior community, I've been able to work with Cindy Sullivan, and she's been drop off deliveries, but it hasn't really come up for, you know, families or anything like that.
Yeah, no, I've done a few deliveries myself, but it's not a large volume of people. I ask what they need. I go pick it up. I bring it to the house.
Good.
But it's a handful. It's not, we're not talking 50, 60, you know, people or households. We're talking very, you know, maybe they're alone, maybe they're on a certain income, and they're in isolation. They can't leave their homes, and they don't have anywhere else to turn. So, I mean, those are building relationships with the community. They feel safe to say, oh my gosh, I need bread and milk and juice to get me through like 3 or 4 days until I can get out of my house. That is our job. That is our job, to serve the community. And it's awesome.
When I had to quarantine, the state had called me and they offered to do that. Yeah. The next day that they were contacting.
Yeah. The CTC is very, they're amazing.
They actually did a liquor run for me.
They're amazing.
Yep. To see who's paying attention and stuff. No, they didn't.
I was. And so, Kate, that's the reason why I love working with you. We have very similar mindsets about why we do our jobs.
Absolutely. When somebody asks or says, I don't have food, or I'm nauseous and I can't eat, what do you need? And the COA is, you know, they're closed or whatever. Okay, that's fine. Give me your list. We're serving the public, not just for COVID. We're serving people.
Tammy?
Hold on.
Oh, okay, Tammy.
Yeah. Tammy, where'd you go?
She went to take care of one of her children, or probably.
Oh, maybe it's just a bad signal.
Hear the voice.
It's a wonderful
thing. Okay.
Doug.
Yes, ma'am.
How are you doing? You've been so quiet.
Bad internet.
Oh, I'm just taking it all in.
Yeah, the less he says, the better.
Are you overwhelmed?
You're damn right about that, Dr. Asia. You're damn right.
Happy birthday, by the way.
Thank you.
You're welcome.
This is an amazing community. You can.
Amen. I mean, we were talking. There's countless stories of people helping people, and not just with COVID, right? And it's not just. This is a fantastic community that we live in, you know, and you know, some days when there's, you know, that generally there's a bad day, you know, you kind of look at it and go, you know, on the whole, now he's making faces at me. On the whole, you know, we do have a great community, and there's great people that work for the town. There's great people that live in the community that are helping each other, and that's great to see.
Absolutely. It makes us more humane.
Tammy, tell us about the vaccine, or what's left.
Okay. It's funny because it goes in these waves where it seems like it's over, like this just incredibly like overwhelming task, and then we get a little bit of information, and then
and then Tammy and I talk, and I said, Tammy,
yeah,
we can do this. We can do that, right? Like it does seem overwhelming, but totally manageable.
So the information gets kind of given out little by little from the state. and most at first it's really in the form of questions. That's how I felt like I was getting any of my information. Like, if a shipment of vaccine was going to be sent to you on January 11th, would you be able to vaccinate right away? Like, these are the kind of, they don't tell you these sort of things. So so in the beginning, I had we filled out the vaccine agreement, which is what the towns, if we want to accept them, we had to do the vaccine agreement with MIIS, which is the Immunization and Information Services. Is that what it's called? I feel like I don't know the names of a lot of the
They're just making all these acronyms up as they go along these days.
Yeah, they are. And then, then I contacted MIIS to make sure that we're still have PIN numbers and we're still vendors. So if we need to bill, and so it was kind of rolling, but nothing felt like we really were getting information. And then on our, together, we started to talk with Agawam, because we were hearing that, if we partnered with them, with other towns, and we had larger numbers, we were more likely to get vaccine for first responders. So we had started doing the kind of putting our numbers together and putting our heads together on that. And luckily, the state did accept the agreement, and they should be getting their shipment on the 11th. And there will be, shortly after that, they will have a full day clinic, and they will be vaccinating all the first responders, Southwick, Agawam, and then maybe about 5 other towns, I think, are on our list. So and it's going to be done in one day. That's what they decided. It's about 300 people.
So what's after the first responders?
So after the first responders, it is starting to look like it becomes less and less our job, which I'm not going to lie, I don't have a problem with that. We found out today that at a minimum 4 sites have more than likely been identified to be called regional mass vaccination clinics. They will be open for phase 2 and phase 3, which is the remainder of the vaccine distribution cycle. They will also be partnering for occupational vaccination. So this is looking like a really good thing that this will be going on. I don't know if they've identified it to the public yet at the locations, but there will be 2 in Western Mass and I think 2 in Eastern Mass so far, which is great. And like they said, they will be open until all of phase 3. They said that it might be in different locations and it might look a little different, but there will be these regional clinics. In the meantime, we've just been also preparing for if the state says it's going to be a necessity that the towns hold their own clinics, making sure that we have the supplies, making sure that Dr. Beltran signs all the standing orders, kind of just talking with our partners to see how they're doing it. And also I've been trying to get communication started with CVS and Walgreens to see if, I don't think they don't really know exactly what kind of role outside of the commercial vaccination they're going to be asked to play with municipalities. So kind of having all these sort of eggs in the basket, because there's, as of right now, the information I don't really even think the state exactly knows how everything's going to play out, but it looks much more hopeful than it did on December 23rd, where I felt like this just giant phony when everyone's asking me what's going on, and I have no information, even though I send out so many surveys and I fill them out and applications, but it's moving.
So my issue, and I know it's on deaf ears, but we've had 9 months to plan for this vaccine rollout. Whether it's frozen Pfizer or Moderna or Mickey Mouse or Chinese. I don't think there's any excuse not to have this down. Where are you going to do it? Who's going to do it? How are you going to register 5 million people? They've had 9 months to do this, and it hasn't gotten done. Everybody's way, well, we have to see how much vaccine we get. We have to see what kind we get. You didn't have to do that. This is how we're going to do it. This is where we're going to do it. And when we get the numbers,
but Jerry, there is a supply and demand.
That, Kate. I'm not disagreeing with you, but your demand is going to be there. We all know that.
Yes, but you can't promise
I didn't say you
doses.
Could, but you certainly could. What my complaint is, you certainly could have identified places. You could have identified how you're going to register people, who's going to register. You could have identified your populations and get them on a list.
They have.
Contact everybody that's first responder or everybody who's got comorbid and is 65 and over. Okay, we don't know when you're going to be, we don't know when you're going to get called, but we need to know where you are, how to contact you, or get 10 websites up and get everybody registered.
Hey, can I ask a couple questions?
Go ahead. So I'm done with my bitching.
Okay.
Go ahead.
On the 11th, how were all the first responders notified for the 11th? Do they have to make a
It's not on the 11th. That's when the vaccine is being received.
Okay. So how are they going about notifying first responders, and do they make appointments? How does that all work?
Yes, these are already pre-registered first responders. And it's not just a walk-in open. It's
so
pre-registered. It's not like a UMass.
Are they sequestering the second doses?
Yeah, it's sequestering. They just have them, right?
They do all first doses first,
and then are they getting the second doses? Or are they having them there and storing them?
No.
What if they don't get them?
No, because of shelf life. So they're going to go through phases, and then they're going to do a second dose phase.
Depending how many people you vaccinate, wherever you get the vaccinations from, they're sequestering that amount that you'll get at a certain date, 21 days or 28 days later.
Yes, that would be the plan that I'm hearing. Okay. So I mean, there's miscommunication. First responders have their stuff right, and it wasn't always clear with public health, boards of health, but it will all come together on the 13th. There's going to be a huge clinic on the 13th in Agawam, and
who's administering it in Agawam?
It's
at a church.
The public health nurse is standing up, Sherry Petrucci, and it just so happens that all of the school nurses are the school's remote, so they're available, and we offered additional help, but she says that it seems like they've got more than enough staff to work on it. So that's great. I mean,
the other thing I want to add is they sent out a vaccination list. I mean, there must be, 100 across the state for first responders. And I think they're going to continue those through the phases. So you don't have to kind of reinvent the wheel. I mean, the list that we have, so Agawam, and then there's one at UMass, but it's very detailed about which towns should register to what clinic based on population.
Yeah.
Okay.
So
can I just say, I'm sorry, go ahead.
I never saw this in H1N1.
So do we know how many from Southwick will be going? Will be getting it?
Yeah, I think we're looking at around maybe 50 people.
How many?
About 50 people, or 50 or 60 people
are eligible, and some people might decline it.
Yeah,
sure.
For this particular group, I think that is everybody who said yes. I'm pretty sure. Yeah.
Can I ask a follow-up question to that? Because this was a topic that came up in a couple earlier meetings, and there was still divided advice on it. And I'm not sure I followed the whole conversation between Kate and Sue. If they get 1,000 doses, they're going to give out 1,000 shots on the 13th. They're not going to give out 500 and put 500 in the fridge for the second shot, correct?
No, because that won't last.
I heard conflicting information in that conversation. I just want to make sure that I understood it, because they're counting on that second bunch of 1,000 to come in to get the second dose, correct?
Is that 1,000?
That's why they're pre-registering, Doug. So the pre-registration are the people that want to get it, right? And they're looking at where to ship it based on that.
So the state or whoever, North Pole or Mickey Mouse, send 1,000 and they'll keep 1,000 and they'll ship it out 3 weeks or 2 weeks later.
There's going to be another shipment of 1,000 to come into that place for the same people that just came in for the first shot on the week of the 11th, correct?
Is that correct?
Right, and they'll have a card.
Yeah, I got the rest. I just wanted to make sure, because there was
Yeah.
discussion we had talked about, obviously, I think the discussion was if you got Pfizer, you got to have Pfizer for the second shot. And then there was talk about batches and lots and all this other. And so that there was talk in this call about they would actually have to hold half the doses for the second shot for the same group. But I'm glad to hear that they're counting on the resupply to cover the second dose.
They don't want us holding
No,
second
and I agree.
doses.
I think that's the right strategy.
This week, I was able to sit in on the training for the registration and insurance registration system that everyone will be using for clinics, and it's very helpful because it's tied with the website that helps to you would order your next batch from, but it keeps track of the people it keeps track of your clinic, and it keeps track of the batch numbers for each clinic.
Good.
So that would go to the state.
Okay.
And you can
Very helpful.
I guess that once you've been approved and you request for the next clinic, you will get it within 48 hours, which is pretty amazing. And that has been the case since December. Yeah.
I think that, this is just Doug Moglen's opinion. I mean, there's been a ton of meetings and plannings. I think the problem is it just becomes a math problem and pace, right? Everyone was looking at it going, out of the gate, we only did X. There's 300 million people in the United States that want to get vaccinated. Dude, just do the math of how many you got to do a day to get us out of, to be able to celebrate July 4th. That's really what you got to look at, right? And so it's just a numbers game. So if I've heard rumors, we got 5 months to inoculate, 5 months, because then you got, the time lapse between shots and the booster, to be in the clear in July. So you're going to start hearing talk about Fenway Park and Gillette, and the governor mentioned it in his presser, and the one in Western Mass, as far as that they can handle just huge throughput. If we did one in town, it would be interesting because they'd have to be open 24 hours a day just to get the throughput, right? They're gonna have to do on a mega scale. We're only 10,000. So just do the math. Work that into 300 million.
So my guess is at our next meeting on January 21st, I think that we're going to see a more robust federal response. It's my guess.
Yep, absolutely.
I was a betting person. And I think that the supply is going to ramp up, and the help's going to ramp up, and the money's going to come. And I think it's going to be a little bit easier on the towns. My guess. I could be wrong, but so I think we're going to get some help. It's going to come on the way. But
I think the bottom line for a local clinic that Tammy and I are most planning for is to have the orders, the standing orders, the emergency kit, the supplies, and how we'll register people. So maybe we do a clinic of 50, right? And you can kind of build that into this system, and then people will have to register. So it's really well controlled.
Good.
And then a week later, you could do 50 more. So we have that ability to do that through this. Is it Prep Mod? What is it, Tammy? Prep Mod, where it's, you know, you have your inventory, you know how many doses you're getting. It's very much electronic in terms of the database, communicating, registering, and then having all the supplies in the vaccine.
And my assumption is there's going to be an ambulance and EMTs at each site to help with any.
We're going to have epinephrine, pulse ox, blood pressure.
AED.
Well, we can use the one if it's in town hall. We could use the AED.
I did during my meeting today. With a lot of the talk that we had is that most towns will be preparing to have EMS on site.
Okay,
because of the emergency operation.
Right.
Okay.
Order.
I think
so that would have to be something that we would have, that we have on site. But honestly, I think that this job is best left in people who are clinical all the time, and I'm hoping that that is where it leads to. But preparation is key. But
absolutely,
I think there are people who make better money off of this than we do.
Well, I'm glad that help is on the way finally.
Mm-hmm. And I feel very comfortable with where we are right now.
Yeah.
Okay.
Based on the planning and the fact that it, came out mid-December.
Yeah.
I am. I don't feel panicked. I feel that we could set up a clinic in a 3 or 4 days or a week and publicize it and get it ready and have the venue and the location and the tables and all that, just like we did with H1N1.
Okay.
So I'm optimistic. Very much so.
And I assume, Doug, that whatever resources we need, we'll get.
Dude, I'm planning the biggest Christmas in July party for mid-July, and whatever it takes to get to that, I'm in.
Okay.
And you're all invited.
Oh, Lordy.
Tammy, anything else we need? Anything else?
No, I'm good. I'm gonna be quiet.
Okay.
No, I think we're good. I think I'm good.
So the number is 340 something, is that correct? From 284, 344, is that right?
Kate, you're muted.
Kate, you're on mute.
Oh, I thought it was me.
Sorry. So between March 1st and today, 344 cases.
That's an increase of 60 for this week.
And that would match the state.
Okay.
Yep.
That's our biggest week-over-week increase, correct?
Actually, we had a high of 60 cases, 11/26, and then they kind of went down a little bit, and then they've resurged. Yeah.
Okay. Doug, you have anything you'd like to ask? Comment?
There was an interesting discourse early in the meeting when I was trying to bite my tongue about that there were some complaints made and followed up and investigated on. And I think that the town's done a pretty decent job of being even-handed throughout this whole thing whenever there's been a complaint made or an observation made that needed to be followed up on. And I honestly don't think anybody's been singled out. And I agree with what Sue said. It was just on its face when you drove by it. You go, that doesn't look right. Someone should have looked at it. When they looked at it, and then there was a reaction to it and corrective action to it. Great. That's where we are. And the same thing goes. I mean, I'm not, if I'm out, if I have to go down to the town hall to sign something at night, sometimes I'll do that, just so I avoid folks and not subject others to me. And I'll go down there at night and do it. And I'm looking to see, I look in parking lots and see what's going on, just drive by. And I don't see that there's any harm in that. And, and I also concur that everybody is battle fatigued, right? Everybody's tired of either, you know, the distancing and the staying at home and all of this, and, you know, those that are going to work and working through this, I get it. And, you know, I would have loved to have seen my family, and I, you know, and done this and done that, and we're not doing it. And so it makes people somewhat mad when they see other people doing things that they probably shouldn't be doing. And then there's, you know, then you have repercussions to it that we're seeing. So that,
Doug,
you know,
I agree with you, but I also see Kate's point of view, and I think we're handling it at this point in a fair and equitable way. And
I do too. That's just my opinion.
I
And
agree with
you know,
you.
and I get it, you know, and I know Dan Valeri next door, right? And I talked to him, you know, many times, right? Great guy. They were doing reservations and remote services and broadcasting and all kinds of superhuman things, because he believes that, and he believes that, you know, the religious and the religious services are critically important to his congregation and his flock. And he considered his personal responsibility that A, no one gets sick at his place, and B, that anyone who wants to partake will find a way to do it, even if he has to go and sing from their front yard. God bless him. And, you know, and I, you know, so I thought it was kind of an affront to them too, with seeing what was going on next door when they're trying so bloody hard. And, you know, so I think it was an equity issue there from that perspective.
Yep.
Okay,
So,
I think we took care of it.
you know, this horse has been beaten to death.
Thank
Absolutely.
You. Okay, so Jessica, you have anything you need from us?
Uh-oh, Tammy wants to beat another horse to death.
It's not, I'm not beating it. So we haven't actually discussed this. Sorry, Jess, I didn't mean to cut you off.
No, that's okay. I wasn't saying anything.
Okay, yes, Tammy.
The travel order was amended before the holidays, and it's now a 10-day quarantine, not a 14-day. If you
That's the other thing that people get, I think, upset about. The goalposts keep getting moved every 2 weeks.
They do.
Or week. You know, and it's people they don't listen anymore because they said, oh well, you know. Anyways, Sue, you have anything else?
Is it 10-day quarantine, or can they get COVID test every 3 days?
It's the same thing with the test. You could get it within 72 hours of returning home, or the 10-day quarantine, or, you know, or quarantine until you have a negative test if you don't want to do it before returning home. Yeah.
Jean, anything?
No, I'm all set. Thank you.
Okay. Who else? Dr. Johnson.
I'm good. I'm good. Thank you so much.
You're welcome. Doug, you all set?
More than. How come we have two Tammys tonight?
Because she's
the laptop.
It's your IT fault person, by the way.
No, I shouldn't have asked.
Well, you asked.
It went out again. I had 2 Zoom meetings on this today, and it was fine. And then I started this meeting up, and the driver for audio is gone again. So I've got my.
Is this the town computer?
Yeah.
Or is that the it's some kind of state phone that Tom used to have?
No, it's a laptop. That's
the Chromebook
laptop?
No, it's the Dell. It's a Dell.
Okay. No, it's your laptop.
Okay, I'd like to make a motion to adjourn the meeting.
Next meeting is the 21st at 6. Okay, everybody stay safe for the next 13 days. Sue, you all set?
Yep, a second.
Second, all in favor? Jerry, yes.
Jane, yes.
Jerry, yes.